through workplace assessment, a collaborative study with St. George's University, Grenada, Ministry of Health, Trinidad and Tobago, and the Pan American Health Organization, Barbados. These three institutions represent institutions of education and practice in the area of public health. The background of this study is a recognition and the necessity for a link between public health practice and educational institutions. This link reinforces the requirement for specific and targeted workplace and workforce development in the area of public health for public health institutions. One of the challenges of this study was the sparse literature as it pertains to the nature, development, management, and the impact of education and practice partnerships. The goal of this study is to enhance public health training, research, and service by facilitating collaboration across the realms of academia and public health practice. The specific objective was to evaluate the integration of Master of Public Health program curriculum with the actual needs of public health workplace. The MPH program in reference is that of the Master of Public Health program at St. George's University. The design for the assessment was to conduct a workplace evaluation of graduates from St. George's University MPH program in terms of their competency and efficiency in the workplace. Some of these workplaces include regional and international ministries of health, county and state health departments in the United States, as well as academic and public health institutions, which all serve as practicum sites for MPH students as well as graduates from the MPH program. The specific competencies that are used in the curriculum of St. George's University MPH program are competencies that have been adapted and adopted from the American School of Public Health ASPH list of graduate public health competencies. The methodology included, first of all, to conduct an alumni survey. Emanating from the alumni survey were a list of employer sites self-reported by alumni. These employers at their sites were then contacted through an employer survey, and they were asked to complete a workplace assessment describing, recording, and documenting the competencies of our alumni from the MPH program at their particular practice site. 61 workplace assessments were returned, 48 from state and county health departments, 7 from ministries of health within the Caribbean region, and 6 from academic institutions around the world. Of the alumni employer oriented workplace assessment survey, 83.3% were found to be absolutely and very relevant. This indicates that 25 of the MPH program's 30 core and cross-cutting competencies were found to be required at the work site, as well as competency of our alumni in these particular cross-cutting and core competencies. Of the 30 core and cross-cutting competencies that were assessed, 5 or 16.7% were reported as hardly or not relevant to the workplace. Of these particular 5 competencies, 4 of these 5 were found to be from county and state health departments, and 1 being from a Ministry of Health in the Caribbean. Work sites, in addition to evaluating the competency, use, and performance of our alumni, also recommended competencies that were not part of the curriculum for the MPH program at St. George's University. these competencies that were utilized in their public health practice but were not part of the curriculum included competencies in leadership and communication. These competencies have since been incorporated into the MPH program curriculum. In conclusion, the majority of the program's competencies were found to be relevant to workplaces that participated in this particular assessment. This is a reflection of the integration of the program's curriculum to align with the needs of the public health practice workplaces. However, the needs, the requirements of public health is evolving with time and with the socio-economic and demographic changes occurring at a global perspective. So it is required for St. George's University MPH program to continue an alumni, employer, workplace assessment to ensure that its curriculum reflect the changing needs of public health practice to ensure that there is integration of public health education and practice at the graduate public health education level. Thank you.